Hi, my name is Maria Embry, and I'm an educational consultant for school readiness, and today's topic is responding to challenging behaviors. The Center on Social and Emotional Foundations for Early Learning's definition of challenging behaviors for children birth to 5 is any repeated pattern of behavior that interferes with learning or engagement in pro-social interactions with peers and adults, and behaviors that are not responsive to the use of developmentally appropriate guidance procedures. So in other words, challenging behaviors are ways that children communicate unmet needs and distress. Let's consider the consequences of not addressing a very young child's challenging behavior. When thinking about infants and toddlers, our concern centers on the price to the child of continued distress. The behavior may become habitual, more frequent, or more difficult to change. It may impact the quality of the caregiving. For example, a child with challenging behavior may receive less positive interactions from his parents and affect peer relationships, as other children may avoid playing with a child with challenging behavior, as well as other developmental areas. Now picture an iceberg in your mind and particularly focus on the tip of the iceberg, the part above the water. The challenging behavior is what you see above the water, the tip. The tip shows the behaviors infants and toddlers use when they're not able to experience, express, and regulate emotions, form close and secure interpersonal relationships, and explore the environment and learn. The rest of the iceberg, which is hidden from sight below the surface, represents potential needs that are not being met. What is going on that causes the behavior? Like the larger portion of the iceberg that is under the surface, the meaning of extreme behavior is often difficult to see and understand. Infant and toddlers have many innate needs. Some of those needs are feeling safe, ongoing responsive relationships with one or more adults, emotionally responsive social environments, an environmental match to the child's temperament, structure and consistency, good nutrition, good health, opportunities for movement, adequate rest, belonging within their own families and cultures, and engaging and stimulating environments. There are two main types of challenging behaviors: acting out and withdrawing. Let's look at acting out behaviors first. Those behaviors may be fussing, inconsolable crying, frequent or intense tantrums, pushing, hitting, biting, frequently throwing of things or knocking things down, persistent refusal to allow or participate in activities, and possibly harm to self or others. Now let's talk about withdrawing behaviors. They may be pulling away while being held, rarely cooing, rarely babbling or talking, looking sad, not showing preference for a caregiver, not making eye contact, whining, being overly compliant or avoidant with a caregiver, and possibly diminished efforts to use communication skills that have previously been used. When we reflect on the meaning of the behavior, we are keeping our focus on the child's experience. We are more likely to be able to respond with empathy for his or her needs and to be more intentional about problem solving. The goal for intervention must be to restore the child's sense of well-being and his or her developmental momentum. We want to use this opportunity to respond in a way that supports the child's social-emotional development and relieves him or her of the need to use the emotional energy to tell us something is wrong. When you see a child in distress, what do you do? Let's talk about appropriate ways to respond to distress. When you see a child upset and beginning to exhibit challenging behaviors, use these responses. Acknowledge distress and name the feelings. You seem so sad, or you look really upset. Offer comfort. For example, change the holding position of an infant and say, "It will be okay. We'll help you feel better." Use words. "You look frustrated right now. You really want that toy." Be attuned to the child's individualized needs. Also, help the child achieve the understood intention. And remember to be developmentally appropriate. Make sure the strategies are appropriate for the individual child's developmental age. It is worthwhile to keep in mind that an important clue to what the child is experiencing is our own emotional reaction to the child. Take a minute or two and write down some behaviors children exhibit that have caused you feelings of anger or frustration. Try to remember specific incidents. For example, when a child pulls hair, does this greatly bother you? Or maybe throwing toys is a behavior that causes you to become angry. After you finish your list, keep it for future reference. Being aware of our own reactions or past experiences can help put a child's behavior in perspective and help lessen our negative reactions. Now let's talk about another very important step in the process, building a team. Building a team with childcare staff and family is crucial in addressing challenging behaviors. A behavior support plan is usually the first step that the team works on. A behavior support plan describes the ways in which the intervention or support of the child will be implemented. It is very important to determine a convenient time for all parties to come together to review the information that has been gathered and to develop a plan that everyone can agree to. Let's talk about what goes into a support plan. First, the support plan begins with a hypothesis about the behavior and its meaning for the child. Next, the team may ask the parent to take the child to the doctor to rule out physical health problems that may be contributing to the behavior, a persistent earache, for example. The team may ask for a developmental and behavioral assessment if initial attempts to support the child are not effective or if the child's behavior is too confusing for the team to even plan an intervention. And finally, the team will need to decide who, what, when, where, and how the support plan will be implemented so that the strategies and responses to the child will be consistent. In conclusion, I hope that you have gained insight and knowledge about why challenging behaviors occur in very young children and how families are affected by this behavior, how becoming aware of your reactions as a caregiver to challenging behavior can help you better meet the child's needs, and how to work with families to develop support plans. Thank you so much for listening and have a wonderful day.